Hello everyone, welcome back to Identification and Care of Surgical Instrumentation. I hope you all have a wonderful Victoria Day weekend. Let's begin. So we're going to be looking at lecture topics for week 2, introducing you to 10 new instruments and showing you how to access Quizlet for your study materials. So first of all, the lecture topics. We'll be looking at surgical instruments more in depth, specifically their categories, functions, how they're manufactured, and their grades and characteristics. So why is it important for MDR technicians to understand surgical instruments? Well, we have to be able to identify, assemble, and inspect instruments to ensure safety. We have to detect damage before it reaches patients, preventing harm to them. We have to know how to clean and sterilize instruments properly by knowing how to disassemble them and to care for them. And also, knowing surgical instrument names is just as important because we have to communicate effectively with OR staff using correct terms. So technicians must know instrument materials, like I mentioned, categories, structures and grades, and we always follow manufacturers' cleaning and sterilization instructions to ensure safety and compliance with their standards. So we'll be looking at categories of surgical instruments now. First, there's handheld. So these are standard instruments like retractors and forceps. We have microsurgical instruments, which are also handheld, but they require extra precision and care because usually they're about 3 inches or even smaller in size. We have powered instruments, which use electricity or gases for more complex tasks. We have endoscopic instruments. Examples include flexible endoscopes, which are used to visualize inside the intestines, for example. There's also rigid scopes, and both flexible and rigid scopes are used for internal procedures without the need of large incisions. In that case, they would also be known as minimally invasive surgery, which includes trocars and scopes, as mentioned, for small incision surgeries. Usually, they're also robotic assisted, like the Da Vinci systems here. And then there's instrument patterns. Surgical instruments feature a range of handle designs, each tailored to support specific surgical procedures, and it enhances user comfort and control. And when I say user, it's typically a surgeon, right? So these handle patterns are carefully engineered to meet ergonomic needs of the surgeon, so it reduces hand fatigue during lengthy surgeries, and it also provides precision in more delicate tasks. There are several factors that engineers have to weigh in when creating patterns. So there are, for example, grip texture, the length, the width, and balance. These are all considered to ensure the instrument performs effectively while minimizing the strain it would put on the surgeon. And then we have our first example, which are the phenolic handles. So phenolic handles are typically heat and chemical resistant. They withstand high temperatures and harsh disinfectants, which is perfect for us in MDRD because these are our preferred sterilization and disinfectant methods. They're durable and non-conductive, so they resist cracking and are safe near electrical devices. They have better grip and comfort for surgeons due to their textured surfaces for the most part. So the textured surfaces, they actually prevent slipping and reduces hand fatigue. So phenolic handles are basically very low maintenance. They retain appearance and integrity for a very long time. And if you look at here, I provided some examples. So from left to right, we have the wire passer, the handpiece, a gouge, a mallet, and screw removal gouge. As you can imagine by its name, the wire passer is used to pass metal wires through it more precisely. And the handpiece is just a manual hand saw basically. So if we go back previous pages here, we have this instrument here, which is called a reciprocating saw actually. And this saw piece here is basically inserted in this part, making it manual. And the gouge is used to pick up a bone fragment, for example, pick up stubborn residues. And the mallet is used for chiseling, for example. You would use it to smash against a chisel or an osteotome to remove pieces of bone or other tough materials. And a screw removal gouge, it's pretty similar to this actual gouge, but it's often used for removing screws off implants. So let's say a patient came in beforehand and received an orthopedic surgery. Uh, let's say they were implanted a metal plate, and eventually they will heal, and so the surgeons will have to go back in to remove that plate since it's no longer needed. It was only temporary, and this part will remove the screw more easily. Next, we have the hollow handle, which is typically used in European-style surgical tools. So as you can imagine, since it's hollow and not solid, it's lighter weight, right? Which reduces hand fatigue during long surgeries. For some of them, the handle is often round or hexagonal, as you can see here, which provides a more balanced feel and ergonomic grip. And from left to right here, we have some bone curettes and Diva retractor. The bone curettes is used to pick off small fragments of the teeth. And the Diva retractor is used to retract organs, tissue, for example. It helps surgeons visualize the field better by pushing aside what is blocking their vision. Next, we have the solid handle. Um, they are made of a single dense piece of metal, giving the instrument a much heavier feel. Of course, this added weight can provide stability and control, particularly in procedures requiring firm, steady pressure, like orthopedic procedures, for example. Uh, However, due to the heavier design of it, it can cause hand fatigue during long procedures. And honestly, for orthopedic procedures, they actually tend to be quite long. The only thing about it is, even though they are heavy, this makes them more durable and actually easier to clean. And examples provided are the extra large pin and wire cutter, another wire cutter, a smaller kind, a solid mallet, and a Balfour retractor. As you can imagine, these two here are used for cutting off pins and wires. heavy duty. And like the mallet, I mentioned it before, it's usually used along with a chisel or osteotome for the most part to chip away at bone. And the balfour retractor is actually a self-retaining retractor too. And what I mean by that is that there's no need for a nurse or surgeon to have to hold it in place. So it frees up their hands to do other procedures. Next, we have rib back or serrated handles. So these handles have raised ribs, if you could see it here, or serrations along the back or entire surface, which enhances grip security, right? As you can see here. They're especially useful when the surgeon's gloves or the instrument itself become wet or slippery, and 100% of the time, contact with blood will make it wet and slippery. The textured surface helps prevent accidental slippage due to this, improving precision and safety. However, because of all these serrations and cracks in it, right, it's much tougher to clean. So you have to ensure no debris remains trapped in these little pockets and serrations, right? And from left to right, we have a double-sided bone rasp and a toothed thumb forceps. And these ones, as you can imagine, is used to shave away a bone, as is included in the name. And then toothed thumb forceps. And it's called toothed because it has two teeth at the tip. Sorry. And then we have a round knurled handle. It features a textured cross-hatched pattern engraved into its handle, as you can see here. I put a close-up picture of it. So this design it's kind of similar to the rib back in that it's more or less it provides a firmer and slip-resistant grip for the surgeon. So it's actually ideal for delicate procedures too, requiring fine manipulation. So the round shape allows the instrument to rotate smoothly in the hand also, giving surgeons better control over angles and positioning. These patterns also require careful cleaning due to debris. They could easily get trapped in here, especially after, um, let's say they finished the surgery and they left it out before it could go to decontam for a bit longer, especially if they don't pre-clean it, it will harden. The blood on it, all the bioburden, microorganisms, it will harden. These are actually among the trickiest instruments to clean, especially after an orthopedic surgery. Oh, there will be a lot of bone fragments, blood on these, dried up severely. And examples included osteotome, like I mentioned earlier. These are often used with mallets. So you would hold this end here with your hand and then smack this end here with a mallet, right, to chip away at bones, for example. And we have a beaver scalpel handle. This is quite tiny for a scalpel handle. And for these ones, this tip here can actually be screwed off, and that's how you place the blade. You would place the blade in here and then screw it back in. So when you receive this in decontam, you have to make sure to screw this off and then brush the inside of this just a bit, making sure there's no trapped blood, and then you have to screw it back in together to make sure they don't separate. And next we have octagonal or hexagonal handles. So as you can imagine, these handles have flat sides and usually have 6 or 8 sides to them. They provide an anti-roll function due to this. So surgeons or scrub nurses, they could just place this on flat surfaces, preventing them from rolling off the tables, for example. The angular design offers a more secure grip and helps align the instrument properly in the surgeon's hands. They also reduce hand fatigue by providing comfortable gripping surfaces, especially during precision tasks. So the design is particularly popular in European style surgical instruments, as I mentioned before. And from left to right, we have the Baron scalpel handle. We have a periosteel elevator mult number 9. These are actually used in dental surgeries. And we have a Cobb elevator, which is actually used in orthopedic surgeries. And our final one is actually an ergonomic or custom molded handle. So these handles are designed with human hand anatomy in mind, often featuring curves, softer materials like silicone here, or finger contours for maximum comfort and control. This helps reduce strain, hand fatigue, and repetitive stress injuries, especially during long or complex procedures. So these handles can be custom made to fit individual surgeons' preferences or specific procedural requirements. The focus is on both comfort and safety, ensuring the instrument is easy to manipulate with minimal effort. And from left to right, we have here bronchoesophagoscopy forceps. We have silicone handles, as mentioned. We have the Castro-Viejo needle holder and a micro-bayonet forceps. So these ones are actually, they come with a tip, like a long tip, so that you could attach it to these. Sometimes they're disposable, sometimes they're reusable, and they're used to retrieve things in your esophagus, included in the name. And silicone handles, these ones are actually very popular in orthopedic procedures. And just like the forceps before it, the forceps handle before it, they usually come with a T handle, sorry, with an attachment to it. And then we have the Castroviejo needle holder. It's just a smaller version of a regular needle holder. This one here would typically be 4 inches or shorter, and it's used in ophthalmic surgery or surgeries on the eyes. And the microbayonet forceps are used for neurosurgery surgeries. All right, so now moving forward, we're going to look at the functions of surgical instruments. So surgical instruments are designed for specific tasks to help the surgeon perform precise actions during surgery. So these include cutting, retracting tissues for better access, grasping, clamping, and dissecting tissues, for example. They are also used for measuring, removing foreign objects, suturing wounds, for example. Each instrument plays a key role in ensuring a safe, efficient, and successful procedure. And so our first one will be to cut or incise, right? So instruments like scalpels or scissors are used to make precise cuts or incisions in tissues during surgeries. Scalpels are often the first instruments used during a surgery, especially in surgeries like laparotomies, as it helps surgeon access the surgical sites. And these ones are often referred to as sharps, and we have to watch out from sharps injuries from them, right? The next one are instruments that retract. So retractors are used to hold back tissues, such as skin or organs, to improve access to the surgical site itself. So after you cut into a patient, you need something to hold the skin from closing in around the surgeon's tools. So you use a retractor to keep consistent access of this surgical site. An example I've shown here is an Omni retractor. And now we have instruments that grasp, hold, or occlude. So forceps and clamps are used to hold tissues, organs, or blood vessels in place, or occlude them to prevent bleeding. So occlude basically means to block or close off a passage, opening, or vessel within the body. Typically, these instruments are used to prevent patients from bleeding out. And an example we have here is a cryo forceps. Next, we have instruments that dilate or probe. So dilators or probes help widen passages or openings, cavities, and it helps surgeons assess tissue condition too. So they're used to gradually enlarge narrow openings such as the urethra, cervix, or blood vessels to facilitate the insertion of medical devices. For example, they help prepare areas for catheter insertion, biopsies, or endoscopic surgeries by ensuring a more smooth access. When used properly, dilators reduce the risk of excessive force, which could otherwise cause tears, tissue damage, or scarring. So for this reason, dilators usually come in sets, right? So that the surgeons can decide and gauge based on the size of the opening which one can fit through without causing tears. And as an example, we have lacrimal probes here, which are used in eye surgeries. Next, we have instruments that cannulate or drain. So cannulas and drainage tubes are examples, and they're used to insert into body cavities to allow fluid drainage or access for other procedures. So cannulas, as an example here, we have a laparoscopic trocar cannula, which is used in laparoscopic surgeries. These can be used for drawing blood or measuring blood pressure. Drains help prevent the accumulation of fluid such as blood, pus, or serious fluid at the site of surgery or injury, which helps lower the risk of infection and promote healing for the patient afterwards. Next, we have instruments that aspirate, inject, or infuse. In an example, I have an aspirating needle. These ones are actually quite long, and this example I've given are used for laparoscopic surgeries mainly. Alright, so syringes and needles are examples, and they're used to remove fluids. In that case, that would be called aspirating, or administering medication, or injecting, or introducing fluids, or infusing. So aspirating uses a syringe or needle for the most part to remove fluids or gases from the body, such as drawing blood or draining abscesses. Injecting is introducing substances like medications or vaccines to the body through a needle, often via IM, SC, or IV methods. So infusing is when we slowly deliver fluids or medications into the body via an IV or syringe, and they're commonly used for rehydration or controlled drug delivery. So a lot of the time these instruments, they are single use or disposable. Um, and I believe it's the injection needles, we never reprocess these, or at least I personally have never had to reprocess injection needles, only syringes and some aspirating needles. And next, we have instruments that suture or ligate. So suturing instruments and ligatures are used to close wounds or tie off blood vessels. Um, some example instruments are used a lot are needle holders. So they are clamps that you are used to securely hold needles during suturing, with types like Mayo Hager or the Castro Viho that I've shown earlier. So anything with the words needle holder in their names are very much capable of suturing and holding needles. Clue in the name. And sutures, of course, must be used. So these are threads used to close wounds available in absorbable or non-absorbable types based on surgical requirements. And we don't actually sterilize suture materials. They are obviously going to become a part of the patient. And an example of shown here is a LigaClip single clip applier. So this one is actually it, the surgeon or nurse scrub, they would place a clip at the end, and as you can imagine, that's how they staple the surgical site. So they used a staple to close it off. To measure or calibrate is our next one. And these are measuring instruments like rulers or calipers, which are used to assess tissue size, depth, or length during surgery. So I've mentioned the calipers. They're used to measure the external or internal dimensions of tissues, wounds, or other anatomical structures like organs, for example. They provide precise measurements often used in orthopedic and plastic surgeries. And another orthopedic instrument that's used a lot are depth gauges. And usually these instruments are very helpful because if you can imagine, we have a patient that comes in, let's say with a broken femur, and you need to use the correct metal plate to keep them in place so that it can promote better healing for the patient. You would have to use a ruler or a depth gauge or a measuring device to calculate the distance between the broken bones and then so that you could screw in a proper metal plate. And next we have visualizing instruments. So very common ones are endoscopes and even microscopes. It allows surgeons to view internal organs or tissues, often during MIS procedures or minimally invasive surgical procedures. These instruments provide critical visual guidance to enhance surgical precision, which minimizes risks and improves patient outcomes. And the example I've shown here, if you guys can remember from last week's class, the Ferrera breast retractor, these allows surgeons to see into the surgical site better by providing a very strong light. Alright, and now we have instruments that coagulate or cut using energy. So these instruments are also called electrosurgical instruments, and they use high frequency electrical currents to coagulate tissue or cut through it with minimal bleeding. The goal of coagulation is to seal blood vessels or tissue surfaces by using heat or electrical energy, which provides further bleeding. This technique obviously helps minimize blood loss, which is crucial for patients' stability. Oh, and an example we have here is a bipolar forceps. It's not much different from other forceps. It just allows surgeons to cauterize wounds with it. And our next instrument type are ones that manipulate bone or hard tissue. So instruments like bone saws, chisels, or rongers are used to cut or shape bones and other hard tissues. These instruments are essential for surgeries involving the skeletal system typically, so that includes orthopedics, dental, or maxillofacial surgeries. They're specialized to handle the rigidity and hardness of bone and other dense tissues while ensuring precision and safety during surgery. And our final example would be instruments that retrieve foreign objects. So foreign body retrieval instruments like forceps or magnets are used to retrieve objects accidentally introduced into the body. Instruments used to retrieve foreign objects are essential tools in surgery and emergency medicine, especially. And they're designed to safely and effectively remove foreign bodies, such as shards of glass, metal, or other debris from the patient's body. So these instruments are distinct from general grasping tools because their primary function is object retrieval, not simply holding or manipulating tissues or structures during a surgery. Excuse me. Okay, so now that we've looked at the specific functions of surgical instruments, we'll move on to the materials they are made out of. Surgical instruments must balance strength, precision, and biocompatibility. So biocompatibility refers to a material's ability to perform its intended function inside the body without causing harmful reactions such as inflammation, toxicity, or rejection by the immune system. So in short, a material has to be compatible in the body without causing it any allergic reactions. And the most common materials are stainless steel and titanium, each chosen for specific properties. And we have stainless steel, which are used widely for general instruments. An example grades of it would be martensitic, which is hardened for cutting tools. Austenitic steel, which are corrosion resistant and are usually used for non-cutting tools. We also have titanium, which is preferred for delicate or specialized procedures. They're non-magnetic, lightweight, and strong, ideal for microsurgery and MRI safe instruments. So they are very good for neurosurgery and ophthalmology surgery, procedures. They reduce surgeon fatigue and eye strain due to its non-reflective and blue-tinged surface. They are highly corrosion resistant due to their protective oxide layer. So we're going to talk a bit more about the types of stainless steel used most commonly in the hospital or healthcare field. So we have the martensitic stainless steel. And as mentioned, they're known for their hardness and ability to hold a sharp edge, so they're more likely to be used for cutting tools. And then we also have austenitic stainless steel, which are highly resistant to corrosion. But of course, they still require proper care to avoid corrosion. And they are more likely used for non-cutting tools. Now we're going to get to the specifics of it. So stainless steel, or the martensitic version of it anyway, is also called 400 series. And surgical instruments use specific grades of stainless steel depending on the function of the instrument. So for 400 series, this type is heat treatable, allowing it to achieve high hardness and sharpness retention, critical for cutting instruments, like I mentioned. And examples include scissors, scalpels, and even needle holders. And as you can see, needle holders, their main purpose is to hold needles, which are sharp instruments. So it's very important that for the most part, a lot of them are made out of these 400 series stainless steel. However, due to its slightly less corrosion resistant material, again, as I mentioned, careful handling, immediate cleaning are very essential to maintain their integrity. All right, and then we're going to move on to 300 series austenitic stainless steel. So this type is non-magnetic and highly corrosion resistant, even in harsh sterilization environments, making it ideal for instruments like forceps, retractors, and clamps that don't require a sharp edge but need long-term durability. And if you think about it, retractors and clamps, they have constant and consistent they're constantly touching, blood, tissue, because their whole job is to keep them in place, right? So its superior resistance to rust makes it especially useful in instruments exposed to fluids, as mentioned, or used in procedures where corrosion would compromise safety. So basically, the 300 and 400 series designations for stainless steel come from the AISI classification system, or American Iron and Steel Institute classification system. It's a way to group stainless steels based on their crystal structure and alloy composition. And we have another special variant actually that could be seen in the healthcare facility, and it's called a 316 LVM. And it's a high-grade stainless steel used for mainly for implants. It contains chromium, nickel, and molybdenum, along with, of course, stainless steel. And this gives it a superior corrosion resistance, especially in the body's chloride-rich environment. Because it is within the 300 range, this series is closer to the austenitic stainless steel in properties than it is to the martensitic. So LVM basically just means low carbon vacuum melted, which ensures purity, low impurities, and high biocompatibility. This makes it ideal for long-term surgical implants like bone plates and screws, where strength and resistance to corrosion are critical. And now we have passivation, which is a critical post-manufacturing process for stainless steel surgical instruments. It involves immersing the instrument in a nitric acid solution, which removes surface iron and contaminants. This allows a thin protective chromium oxide layer to form naturally on the surface of the instrument. This layer is what gives stainless steel its corrosion and stain resistance. While durable, this layer can be worn down by mechanical damage, harsh chemicals, or improper cleaning. And to maintain it, right, regular steam sterilization supports the natural reformation of the chromium oxide layer. Water-soluble lubricants during cleaning cycles also help protect the passive layer by minimizing friction and wear. If the passivation layer is compromised, the instrument is vulnerable to rust and corrosion, which not only affects its function but also poses patient safety risks, including contamination or injury. And for that reason, we're going to talk about why abrasive brushes cannot be used to clean surgical instruments. So, of course, there's surface damage. Abrasive brushes can scratch the passivation layer that we just talked about, leaving instruments vulnerable to rust and corrosion. Of course, germs hide due to all these scratches that abrasive brushes can put on surgical instruments. And these scratches and gouges create spots where microorganisms can linger, reducing the effectiveness of sterilization. And of course, due to this, it makes the surgical instruments have a reduced lifespan. Damaged surfaces lead to faster wear, increasing the risk of corrosion and mechanical failure. Now we're done with that. We're going to talk about understanding instrument metal terminology. So stainless steel is the preferred metal for surgical instruments due to its strength, durability, and corrosion resistance. High quality instruments, especially OR grade instruments, require skilled craftsmanship for consistency and performance. Grades and other characteristics of handheld instruments. So, handheld surgical instruments are classified by grade. We have surgical grade, floor grade, reposable, and disposable, based on the materials, manufacturing standards, and intended use. And the first thing we're going to look at is surgical grade instruments. And typically, these instruments are used in the operating room, which is arguably the MDRD's probably their biggest customer in any healthcare facility. So surgical grade instruments, their purpose, um, they have to be of the highest quality, designed for repeated use in surgeries. The materials are made from premium stainless steel, sourced from top manufacturers in the US and Germany. Uh, Features include durable, corrosion resistant, and precise with long lifespans. Identification, they are etched with country of origin, catalog number, and manufacturer name for traceability. And of course, they are also regulated by the FDA, which requires marking of country of origin to distinguish from lower quality instruments. Now we're going to talk about floor grade instruments. So the economy instruments, that's what we refer to them as. They are economy instruments for non-sterile or short-term use. So imagine they are used in labor and delivery, emergency department, radiology, for example, where a sterile field is not exactly critical to the patient's health. They are made from lower quality stainless steel, often from lesser known manufacturers. So, a lot of these manufacturers that send these low quality stainless steel are actually from Pakistan because they are known to send us higher quality stainless steel from these grades in a cheaper manner. And so now we're going to look at the features. They have a shiny finish but less precise, but they are less precise and durable, which makes them prone to rust and wear. Intended use, they must be used in a cost-sensitive, non-critical environment like clinics or, like I mentioned, the less critical departments of any healthcare facility. And again, I want to reiterate why we have to separate surgical grade or grade instruments from floor grade instruments. And if you are actually working in the MDRD, especially in the assembly area, we actually have assignments catered to build only trays for the OR room, which are used for, uh, elective cases, emergency cases, urgent cases. All of these are scheduled in advance or like with it, like months in advance, or obviously for emergency cases, they are done as soon as possible. But these instruments have to be OR grade and cannot be floor grade instruments, right? And then there's floor grade instruments too, which are used by L&D, emergency department, radiology, dialysis, all of these. So my point is, when you're building trays, there's actually assignments catered for building trays in OR for OR cases and also for what we call floor trays. And floor trays just refers to you know, um, departments that are less critical in their sterility, right? Um, and of course, I mentioned the leaching effect last class, I believe, and it basically just means the mixing of two metals, two very different metals, which can cause hazardous effects on instruments, which of course will put a risk on patient safety. And that's why these two can never be used together, can never be built together, and they should not be cleaned together. And another proof of this is that for a lot of hospitals, they actually have schedules for transporting floor grade instruments and surgical grade instruments. So we would have a dedicated transporter going around the hospital, picking up instruments from the OR, then dropping it off to the contam. And then they would also have the transporter go around the clinics, let's say at 3 p.m. That's a designated time for picking up clinics, the clinic, or sorry, floor departments. Instruments that were used. So I say clinic because a lot of hospitals call the departments that are not the OR clinics for the most part. Sorry, I went on and on about that. Next one is reposable instruments, and the purpose of this is they're designed for multiple uses, reprocessed, that is cleaned and sterilized between uses. They are made from medium quality materials that can withstand several sterilization cycles. They are reusable with a limited lifespan. So they require proper inspection and maintenance, and you also have to ensure that you're not using them above the lifespan as mentioned. So let's say you receive a Da Vinci Systems instrument. They are typically used, I believe, 20 times before you have to dispose of them. So another thing that's very important to have in any MDR department is a proper instrument tracking system. So let's say you received a brand new Da Vinci or any other robotic instrument that's reposable. You would have to keep track of its usage because anything above that can compromise the patient's health and safety. It could be that, let's say, it was used 19 or 20 times, and on 21st time that it was used, it could break down on the surgeon during a surgery, which is obviously not a good situation to be in. So that's why traceability is very important for reposable instruments. So they're used in settings where tools are frequently needed and can be reprocessed between surgeries, balancing cost and quality. So disposable instruments. These are designed for single use and discarded after use. Clue in the name. They're marked single use, preventing cross contamination and eliminating reprocessing costs used in emergencies or some sterile procedures. They are not for reuse. Reprocessing compromises integrity and safety for the patient. And they are more common in outpatient clinics, emergency settings, and areas requiring guaranteed sterility, but that needs to be in a fast-paced environment, right? So now we're going to move on to the types of finishes. So we have handheld surgical instruments. They have various finishes, each serving a specific function. So we have the shiny or bright finish. They are a highly polished surface providing a mirror-like appearance, making the instrument easier to clean and reducing tissue adhesion during procedures. This finish also helps prevent rusting by creating a smooth, non-porous surface. They are common in scalpels, as you can see here, forceps and fine instruments, which are used in the more precise and delicate surgeries. And these ones are just very typical scalpels. This one is number 7. Number 3, which I would say is the most common scalpel. It does look similar to a number 4. And these are called Baron, I believe. It's been a while. I'll have to double check. Oh, no, they're a number 5, round scalpel. And now we have a satin or matte finish. So they have a dull or non-reflective finish. So it minimizes glare, improving visibility, and providing better control, especially in low light or high precision environments. This texture also enhances the instrument's grip, reducing slippage during use. And they are very common in scissors, needle holders, as shown here, clamps, and other instruments requiring enhanced handling, like this Alice forceps. And then we have black or ebonized finished surgical instruments. So they have a dark, non-reflective finish created through chemical treatments or surface oxidization, reducing glare and improving instrument visibility under bright lights. This finish is particularly useful for instruments used in procedures where visibility is critical and any light reflection could hinder the surgeon's view. So it's common in microsurgery, ophthalmic surgery, and other specialized procedures requiring minimal light reflection. All right, now we're going to look at the anatomy of scissors. So we are going to start off with blades, which are the cutting parts of the scissors. They can be straight or curved, smooth or serrated. Serrated blades grip tissues, while smooth blades are used for clean cuts. The tips, so the ends of the blades, right? It's these ones here. They can be sharp or blunt. Sharp tips are more for precise cutting, while blunt tips are used to avoid injury. Then we have the shanks, which are these long handles here. As you can see, these ones here. Sorry, they're the long part of the scissors or any other handheld surgical instrument that are between the blades and handles. So section between blades and handles, they affect reach and balance. Longer shanks allow deeper access. Shorter are for more precision. And then we have the hinge here, which is the pivot point. They're also called box lock or screw joint. They ensure smooth blade movement. Misaligned hinges cause poor cutting performance. And then we have the handles. Typically, they are finger rings and used for control. Thumb and ring middle finger placement, usually two, are used. Ergonomic designs reduce hand fatigue during long use. So now we're going to look at some colored handles for the scissors, which one of the students actually brought up last week. They were asking what it meant. So what does a gold handle mean? So gold handles indicate that the scissors have tungsten carbide inserts, or also known as TC. TC is an extremely hard alloy, enhancing cutting precision and durability. So instruments made with tungsten carbide, they cost twice as much, but they last up to 5 times longer than standard stainless steel. So if you think about it, with these instruments staying sharper longer, they offer better precision, and yet despite the higher upfront cost, in the long run, they are more cost effective over time due to their longevity, and they don't have to be sent out for repair constantly. And so now we're going to look at scissors with black handles. So black handles they mean supercut scissors, and they're used for thicker and tougher tissue. So the blade design has one razor sharp blade and then another one serrated blade for grip. So it creates a slicing action due to this, which creates for a cleaner and more controlled cuts. So these kinds of handles offer better precision than standard to smooth blade scissors, right? And now we're going to try to understand tungsten carbide in surgical scissors and any other common maintenance questions for it. So furthermore, tungsten carbide enhances the durability and sharpness of surgical scissors. And this section covers the role of tungsten carbide in scissors, the maintenance and care for these surgical scissors, and proper techniques for handling and cleaning these precision tools. So I have it in the notes section of the slides page. I'll just bring it up here in a Word document. So these are the common questions for it. So it's, why is tungsten carbide used in scissors? So tungsten carbide is harder and stays sharper longer than stainless steel. They maintain sharpness much longer. And obviously, as mentioned, they are often indicated by gold handles. So can tungsten carbide blades be replaced? No, unfortunately, once worn down, the entire scissor must be replaced. And does the gold wear on scissor rings affect the scissors? No, the gold is just an identifier for tungsten carbide blades and doesn't affect performance. And next question is, can paper be cut with surgical scissors? No, paper dulls surgical scissors, reducing their effectiveness. What is the best scissor for cutting suture? So this one would be a 6-inch straight Mayo or a 5-inch operating scissors with sharp tip or sharp blunt tips. You would avoid medicine ball scissors, which I will actually get into later. Should scissors be taken apart to clean? Never. You should never disassemble any scissors or surgical instrument that has a hinge, right? So you see some scissors and instruments, they have a visible screw to their hinge part. You should never tighten that on by yourself. If you see a loose hinge, you have to send it out for repair. So yes, no disassembling can damage the scissors and affect its performance. And now, should an MDR technician tighten a scissor screw? Like I mentioned, no tightening requires proper technique, so loose screws should be sent for repair. And so now we have this one. How and why do scissors crack? So scissors crack when dull, requiring excessive force, right? A cracked hinge means immediate replacement. So why do longer scissors feel loose? So scissors, they come in several sizes, and some of them can reach up to 9 inches, and there are even some that can go up to 12 inches. And obviously, longer scissors have, a longer shank, which makes them more loose. And can a sharp tip be replaced? Yes, a skilled technician can repair a broken tip, which is more affordable than buying a new scissors. And when I say technician, I do not mean a MDR technician, I mean a repair technician. So that would typically be a biomedical engineer of some sort. And then the 11th question, are there left-handed scissors? Of course, if we have ergonomic or custom molded instruments, we would have left-handed scissors too. But these ones are typically actually requested by surgeons if they wish. And they are common in Metzenbaum and Mayo scissors. So why are some scissors blue? As you remember, the blue tinge on some instruments mean they are made of titanium, which is lightweight and stronger, but more expensive than stainless steel. So we're done with this section. I'll just remove that. So now we're going to move forward and introduce you guys to new instruments. So we have, I believe, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. Oh, not even. Pretty sure I had 10 here. Oh, yes, we do have 10. So it's 4, 5, 6, 7, 8, 9. Okay, no, I'm going crazy. We apparently have more than 10. Okay, so we are going to talk a lot about scissors since I'm, of course, mentioned them today. So the first one is going to be a group of Mayo scissors. So last class we talked about straight Mayo scissors. This time we're going to talk about curved Mayo scissors. And remember, the difference between straight Mayo scissors and curved Mayo scissors is that straight Mayo scissors are more for suturing, while curved Mayo scissors are known as dissecting scissors, and that's because they're used to cut tissue or muscle. So any scissors, be it Mayo scissors or Metzenbaum scissors, could actually be supercut or made of tungsten carbide. And then we have a Noble Mayo scissors, which if you look closely has a slightly wider shank and blade, right? This part here, compared to a regular straight Mayo scissors. They are called Noble scissors for short, and they have the same function as standard Mayo scissors. It's just that some surgeons prefer these for their sharpness, and they are also longer lasting in integrity. And then we have supercut Mayo scissors, which I've already gone over. Any black handled scissors are supercut, and they're used for cutting tougher tissues or suturing materials. And of course, because they are supercut, they're much more expensive than regular stainless steel scissors. And we have tungsten carbide Mayo scissors, so we have a straight one here and a curved one here. And as you know, straight is used more for suturing, while the curved one is used more for cutting tissues. We have the Metzenbaum scissors, which are also very common along with the Mayo scissors. They're used for cutting or dissecting delicate tissue, and they should never be used on cutting suture or sponges or heavier tissue. So that could be muscles, for example. And so as you can see, the difference between Mayo and Metzenbaum is that it has a longer shank. It has a very long shank, right? And shorter blades. And they could come in straight or curved. All right, so I also mentioned sharp sharp and blunt blunt earlier. So when we say something like sharp sharp or blunt blunt, we're referring to their tips. So some instruments have blunt tips and some have sharp tips. But did you also know that some instruments have a mix of both? So one would be blunt and then the other would be sharp. A lot of the time, those are operating scissors. That's what we call them. So when you talk about operating scissors, let's say a scrub nurse called down to MDRD requesting for operating scissors, they always have to let you know what kind of sharpness to give. So they would say, hey, I require a operating scissor up here in OR number 8. You have to ask them, is that a blunt blunt, a sharp blunt, or a sharp sharp? And now we have Edna towel clips. So they're very similar in looks to the backhouse towel clips, which we talked about last class. It's just that the backhouse towel clips are known as the sharp towel clips, while these ones are known as blunt towel clips. So these are more used for securing drapes or suctions or camera cords. They're not really used inside the vascular system. And next we have a Fraser suction, which is very common in nasal surgeries, ENT procedures, neurosurgeries, and their main purpose is for suction, as you can imagine. So if you see this hole here, the surgeon could use their thumb to cover this hole up to control suctioning so they could turn off the suctioning or turn it on. Oh, sorry, turn it off by taking their thumb off this hole and then turn it on by covering it. And these actually have they have a lot of diameter sizes. So it could range from very small holes like 3 French all the way to, I think the biggest I've ever seen was 13 French. And the most common sizes are actually 7 French and 11 French. And typically these ones actually come with what we call sheaths. These sheaths here. There's a sheath inside this. It's not always required though. You just have to ensure that when you're building trays, you follow the recipe. And now we have a Rochester pin forceps. So this one could be straight or curved, and they're used for clamping heavier tissue. So as you can see here, all the way from the bottom, reaching the hinges, they have fully serrated jaws, which is important later on because I will be introducing other forceps, but they have serrated jaws. So we have pin forceps here. So this one is just a smaller version of the Rochester pin, really. And they have the same function, but the pin forceps is actually used for vessels too. And just like the Rochester pin, they have straight or curved jaws, like this one. And then the Kelly hemostatic clamp, as you can see here, unlike the Rochester pin and pin forceps, this one is only half serrated, and they're used for clamping large blood vessels or tissue. Cryo hemostatic clamp, so this one is also called a snap or cryo simply, and they're for clamping blood vessels or tissue. I would say this is the most commonly used size of any hemostatic clamp. So these ones could be 6 inches. Anything less than that, it would no longer be called a cryo or snap clamp. It could also be called a forceps. And we have the Halstead mosquito clamp. So these ones are typically 3 inches to 5 inches, and they're used for clamping delicate blood vessels or tissue. Don't worry, I think for week 3 I'll bring these in person just so you see the clear difference between them. And as you can see, this one is not partially serrated, but it does end a bit earlier than the Rochester pin. And if you were to look at it actually, you would see that the upper part of the instrument is very short compared to a pin. And if you look at the pin, the upper part and the lower part are very close in length. So Not one part is longer than the other, which compared to the krill or mosquito, they tend to have a shorter upper body. And now we're going to look at retractors. So this one is a weight liner retractor. So this one has no hinges, which is an important fact, as you will see another retractor later on with hinges. So this is used for exposing superficial wound. And if you remember what that word means, props to you. So superficial wound means, anything that's on the skin, nothing bone deep, right? And this one is a self-retaining retractor too. So a lot of hospitals would prefer to just call this as self-retaining retractors or self-retainers instead of using their actual name. And I'll get to that in a bit. Oh, another important fact, they have different prongs for the most part, depending on the length of the instrument. So shorter instruments, I believe 4 inches or less, they would be called baby self-retainers due to their size, and they typically have 2 by 3 prongs, while longer ones have this one, 3 by 4 prongs. And now we have the cerebellar retractor. It's also called the Adson retractor or an angled self-retainer. You can see the very obvious angle on the shank part here, and this one is also not hinged. And this one is used more for exposing wounds, so you could say this is like the middle layer, while this is the top layer. And typically they have 4 by 4 prongs, whatever size of it. And this one is the Beckman retractor, which is hinged, as you can see. So if a nurse were to call you asking you for a self-retainer, you would have to ask them if they want an articulated or hinged retractor, self-retractor, or a non-hinged one. Honestly, there's not much difference to them, but sometimes it does matter to them. In that case, if they don't specify, just give them one of each, right? And on that note, they actually usually come in pairs. So this one is used for exposing wound, just like the cerebellar. And typically they have 3 by 4 prongs. Oh, and another important thing to mention is that they could have blunt or sharp prongs. All right, so now we're gonna get into what self-retaining actually means, right? So these instruments hold themselves in place without needing someone like the surgeon or a scrub nurse or any other OR personnel to manually keep them open. So they have a lock, as you can see here, so that the surgeon can decide just how wide they want the wound exposure to be so that they can work on it. And yep, so some implications. It frees up hands, of course, and it provides a constant exposure of the surgical field. And of course, due to this, it reduces hand fatigue. And that's all for today. That's a conclusion of week 2. I will post a separate video on how to actually access the Quizlet site, how you could become a member of it. It's completely free on the student's part, but I highly recommend you use this to your advantage. You could be in a train, just casually strolling through, answering questions, studying. Um, so this Quizlet could actually be downloaded on any smartphone. I believe Android and iPhones, they have it. So please use them. And that's it. Thank you so much for showing up here. I'm so sorry that you ended up having to do some studying after all for this. I genuinely thought we were completely off for the weekend, but I was required by the college to send you guys a makeup class of some sort. So I thought, you know what? I don't want you guys coming in on a weekday or before the class to make up for this. So it's better to post a video. Anyways, I hope you guys enjoyed and learned some new things here. I'll see you guys next week. I will be working on the any questions, maybe improving the Quizlet for this week. Just be patient, guys. I am also a student myself. Really appreciate it. All right, have a good one. Bye bye.